everyone. Welcome to our Facebook Live. My name is. Oh, did we start? Okay. Hello, everyone. Welcome to our Wednesday Facebook Live here. Therapy Works. My name is Danny. I am the patient care coordinator here with us, and this is Brittany Baxter, one of our awesome PTAs. Today we are going to talk about the benefits of laser therapy, which is something very new and very exciting to us, a new tool that we can offer to our patients. So let's get started. Who can benefit from laser therapy is my first question.
Yeah, so any of our patients are going to be able to benefit from laser therapy. Anybody that has pain or inflammation, whether it be chronic or acute pain.
Okay, great. And what does laser therapy do?
Yeah, so medical lasers like the one that we use are going to release photons or energy into the tissues of the affected area. It's going to, like I said, it's going to add energy to the cells. It's going to help to relieve the pain. It's going to increase circulation to the area, which is going to bring in white blood cells, red blood cells, and help promote healing.
Lots of science there. Wow.
Yes,
Yeah.
yes,
A little
lots
complicated.
Of, yes,
Yes, but if you guys have any more
keep
questions,
it simple, but
yes, we have lots of examples of, explanations and studies like that we can give you guys if you want to send us a direct message or anything like that. So, but that is very interesting, very exciting. Is it safe and does it work?
yes,
Okay.
to both questions. So our laser is FDA cleared. Like you mentioned, there are several studies out there that show the benefits and usage of laser therapy. It's been endorsed by the World Health Organization, the American Physical Therapy Association, and then the International Association for the Study of Pain.
Oh, great. Awesome.
And then as far as does it work, like I said, there's thousands of research articles out there that show the benefits of using laser therapy and the reduction of pain that can come from it.
That's great. Yeah, and I also personally can say that I've had laser therapy done when I had my hip injuries, and it really benefited me. Because I had pain in my back, I had pain in my thighs, so we kind of targeted all of those areas, and it really helped me. Okay. Does it hurt?
No.
Okay.
So, short answer, no. Laser therapy, you might feel some warmth from the treatment head that we're using, just because, again, it is a laser, it is adding energy to the skin, but just as quickly as we move across an area, that warmth is going to be gone.
Great. Awesome. What are the risks of laser therapy?
Realistically, the biggest risk would be to the eyes. It is a laser, so there is the risk that comes with exposure to the eyes from lasers, but we've got glasses that both the therapist and the patient wear. We're in a closed off room, so it's not like anybody else is exposed to it. Otherwise, it's non-invasive, it's non-pharmaceutical, so that you're not going to have any of the risks or side effects that could come from medical treatment or surgery or anything like that.
That's great. Yeah, that sounds like a high payoff, instead of getting a surgery that might, alter your life for a while. But
right.
Okay, awesome. What should I expect during my appointment?
Yeah, so it's going to be a quick 10-15 minute treatment. It's quick and easy. We focus on one specific area. Typically, if you have a couple areas that are closer together, we can kind of hit broad spectrum on all of them. But we'll get all around the joint. So if you're coming in for your shoulder and shoulder pain is, just at the front of the shoulder, we're still going to make sure we hit lower under the bicep, out on the outside of the shoulder, above and behind, just so that we're getting the whole joint itself and not just focusing on one small area of the joint. It does have to be direct skin contact, so we ask that the patients wear tank tops, short sleeves, shorts, something that we have easy access to whatever body part we're working on. You're, like I said, you're going to be in a private room. There's going to be just you and the therapists that are in there. We're going to go through a few questions, just make sure there isn't anything we need to know with it being laser therapy and some heat being introduced to it. We do want to make sure you're not on specific medications. If there's a chance of pregnancy, we want to make sure that we're not working around the abdomen, anything like that. But then we're also just going to ask basic questions about, what hurts? What motions hurt? How long has it been hurting? What's your pain level like today? And then we'll administer the laser treatment. Like I said, treatment itself is going to be 5-10 minutes, and then that'll be it for that session.
Great. Awesome. Yeah, and you actually covered what I was going to ask next, was how long the treatment lasts. So
yeah, so like I said, treatment itself is going to be 5 to 10 minutes. It just kind of depends on the area that we're working. Shoulder's going to take less time than a low back or something like that. So kind of a little bit of wiggle room there.
that's great. And then how many treatments before I start seeing results?
Yeah, so it really depends. It's similar to what we say with physical therapy itself. The more long-term something's been going on, the more treatments it's going to take. The
Right.
less time something's been occurring, we can typically get it under control in less treatments. But I would say on average, kind of 6 to 9 treatments is kind of the average that we see for each diagnosis.
Yeah. When I got operated on my hips operations, I actually was getting laser therapy 3 times a week for months.
Yep.
And that after the first month is when I really started seeing results. So just from my personal experience. And then how can I try it out? How can someone come in and get laser therapy?
Yeah, so quickest answer is just, give us a call and speak with the front desk. Just let us know that you're interested in trying out the laser therapy. We can get you scheduled. Because they are quick 10-20 minutes overall sessions, we can usually get you squeezed in pretty quickly. Most of us have some small gaps here and there in our day between patients that we can pull you back into a room and do the laser therapy treatment real quick. Get you back on your way. That way we can start getting the pain under control for you.
Great. Awesome. All right. And is there anything else that you want to add before we sign off today?
No, not really. Biggest thing is, it's very, very low risk. That's the biggest thing I can stress is that, you're not going to have any of the residual side effects that you could have from the medications or surgery. And that means there's going to be kind of a low risk, high reward that comes with it. Anytime we can get pain under control without pharmaceuticals or surgery, obviously, is a win.
Right. Yes, I agree. Well, thank you so much for joining us
Yes,
today, and we'll see you guys on the next Facebook Live. Have a good day. Bye.